So, today we're going to talk about active versus passive euthanasia. And in particular, a view, an argument, well, actually, a couple arguments, but um, we're going to talk about the view that there is no difference, no moral difference between active and passive euthanasia. And this comes from an article by James Rachels. His article is called Active and Passive Euthanasia. And in there, he argues for what he calls the no difference view, basically saying that there is no morally relevant difference between active and passive euthanasia. So I'll say something about what that is, and then we'll get into the paper. There are other views out there that think that there is a difference, which we'll talk about, which he just calls the difference view. But we'll get an idea of, first of all, what's active and passive euthanasia. What does that mean? What's the difference? And then we'll see two different views, just really simply two different views about whether there is an actual moral difference between active or passive euthanasia. And then for today, we'll see an argument for the no difference view from Rachel's. He argues that there really isn't any morally relevant difference between somebody actively performing euthanasia or passively performing euthanasia. Okay, so active and passive euthanasia, the difference is really kind of quite simple, at least on its face. I mean, the difficulties will arise, but the basic difference is that active euthanasia involves what sometimes people call a doing or an action. So it's when you perform euthanasia by actively doing something. For instance, injecting a patient with a certain level of sedatives, enough to stop their heart and circulation and so on, so that they end up dying. Right? So you actually do something to cause their death. Right? You initiate it with some action, some doing that you perform. Passive euthanasia is where you perform euthanasia, killing a patient. Well, I shouldn't say killing. Where you perform euthanasia by not doing something. So oftentimes this gets understood as there's a difference between killing and letting die. But we'll get to that. But basically the idea is, think about it like this. Suppose somebody has an illness where if there is no intervention, right? Or if there is some intervention going on, like they're on a respirator or some sort of machine that's keeping them alive, that if you removed the intervention, then they would die, right? They couldn't live except for being on a ventilator. They couldn't live except for being on some other kind of, maybe even just a medication or some other kind of treatment. But if that treatment or machine was removed, then they would die. Maybe not immediately. Oftentimes it's not immediately, right? It's not like unplug the machine and then they just die. No, it's that they have a disease that will kill them, and the machine is kind of blocking the disease from taking its course because the body itself is unable anymore to perform certain functions or to block the effects of the disease or whatever. And so there's external things that are doing it for them. And kind of common example of passive euthanasia is where we, let's say, turn the machine off, and then just let the disease take its course, and then maybe they end up dying, like a week later, maybe a few hours later. But we're not like actively killing them right now. We're not like doing something that, because of that doing, puts an end to their life in this sort of more direct, immediate way, right? It's because of something we didn't do. So we turn the machine off, and then, the disease starts to take its course, and maybe they start dying. But now we're just failing to keep them alive instead of actively injecting them with some lethal concoction, right? You can hopefully see the difference there. And maybe even a more straightforward case of passive euthanasia is where somebody's dying and they're not on a machine or anything like that. Just let's say we come across somebody, or somebody brings someone into the hospital and they're actively dying. And let's just imagine they could be saved. Maybe they need, what's called CPR. Maybe they need an injection of something. Maybe they're having an allergic reaction or something like that, or poison or toxin reaction. And we just refrain from doing anything. That's at least an example of letting someone die as opposed to killing them. And the main difference is that euthanasia is about a good death. The purpose of the person dying is because it's better for them to die than to continue living. That's at least the idea or the intention with euthanasia. And then the active versus passive is basically just the means of getting this good death. If we decide that the person is better off with their life being ended, for whatever reason, there's lots of different justifications we might think of for that. Maybe we just think it's the person's choice, no matter what. Maybe we think together with the person that, their life would just be not worth living. Maybe there'd be too much pain, suffering, discomfort, and all that. And they're only going to live for another, let's say, week or so anyways. And they want to die now instead of suffer for another week. So if we decide that it's better to let them die or for their life to end, then there's two different ways in which we can help them carry that out. We can do it actively by, for instance, injecting them. Physician-assisted suicide is this way. Or we can do it passively by saying, okay, we think it's better to not keep you living now. We'll go ahead and respect your wishes and take you off the ventilator. And it's happened before where that's happened and then the person doesn't die. It certainly happened a lot where the person doesn't die right away, right? And they end up living for a little while. But some people, miracles, quote unquote, where the person's expected to just die if you take them off the machine or the medication or whatever, and then they don't. Sort of miraculously, we might say. But anyways, the point is, euthanasia is basically about this decision. This decision, if you think someone should be a good candidate for euthanasia, what you're saying is that you think it's better that they die than they continue to live. Dying for them, for this person in this situation, is a good thing. And then there's a question of how we do it, actively or passively. So Rachel's is not addressing whether euthanasia is permissible. He's not trying to argue that we should allow euthanasia or that we shouldn't allow euthanasia. That's not the purpose of his argument. That's not what he's addressing. He is addressing the question of whether active euthanasia is morally different than passive euthanasia. Not whether euthanasia is permissible. Basically, think about it like this. He's saying, okay, there's this debate about euthanasia. Should we allow it? When should we allow it? All this stuff. But let's suppose, for the sake of argument, that euthanasia is permissible, at least sometimes. Okay, sometimes it's morally okay, morally permissible to perform euthanasia. Let's pretend that that's true. And then he says, now, once you even admit that, people still debate about whether it's okay to perform active euthanasia as opposed to just passive. And the common idea is that passive euthanasia seems to intuitively seem a lot better, or at least a lot less worse than active euthanasia. There seems to be some intuitive initial difference. Okay, and then we'll get it. So that's what those things are. That's what his purpose is, to argue that there's no difference between these, not to argue euthanasia is permissible. He does think that, but that's not this argument. This argument is just about whether these are different. Okay, and so you can kind of see this difference in the American Medical Association's sort of statement on euthanasia, where the default position for the AMA is that there is a difference. There is a morally relevant difference between active and passive euthanasia. Basically, they think it's permissible to withhold life-saving treatment at the patient's request, right? Not involuntary euthanasia, where they want to live, but you kill them anyways. If there's voluntary euthanasia going on, the AMA thinks it's permissible to withhold treatment. Once we've decided euthanasia is okay for this person, here's what you're allowed to do. Withhold life-saving treatment. And I think, pretty sure, that means that they would allow like a ventilator to be turned off. Right? Because the ventilator being on and not turning it off is a way of kind of giving them treatment. You're treating the person's failed respiratory system by continuing to keep them on the ventilator. And therefore, taking them off is withholding that treatment that you were previously giving them. Okay, so taking them off a machine, pulling the plug, so to speak, is the phrase that gets used. That's the same with respect to active and passive as not giving treatment that wasn't even there in the first place. So not giving treatment that's not there and removing treatment that is there, right? As long as the removal of that treatment is not synonymous with sort of killing them right then and there directly, right? Withholding treatment in this way is okay. But it's impermissible to administer life-ending treatment, right? So the physician-assisted suicide stuff, where somebody says, I would like to die right now. I want you to take this lethal dose of these drugs, sedatives, whatever, and I want you to inject me with that so that I die. That would be administering life-ending treatment. And they call it treatment. There's a question, I guess, whether you want to call that treatment, but it's administering some life-ending medication, at least, or substance. And the people who are endorse this, who think this is permissible, are going to call that treatment, right? But the point is, the AMA's sort of stance on this is that there is a difference. Active is worse than passive. And in fact, they say even more than that. They don't just say that it's worse. They say that it's actually impermissible to do active euthanasia. You cannot administer life-ending treatment. You can withhold life-saving treatment. Okay, so hopefully that helps see the difference between these two things. So in both cases, we would say, okay, this person is requested to die, and we think that it's permissible in this case. Now we can either withhold life-saving treatment or we can administer life-ending treatment. Well, the AMA says this is bad, this is okay. All right. So this difference is often called the difference between killing and letting die. It's often seen or understood as a case of the killing being different morally, and in particular being worse, than letting someone die. So when you withhold treatment, you remove the ventilator, you unplug whatever, the machine, that's to let someone die. Because you're not actively killing them, you're just letting the lethal disease process, which is not going to be immediate and direct, take its course. It's not going to be a direct result of you unplugging, right? Lots of things are going to happen. The disease will have to sort of go through its normal course of killing the person, the organs shutting down and all that. That's different. That's letting someone die by the disease they have, by removing the impediment that you had put up, versus actively killing or causing someone's death. Now, when we try to think about the difference between these, Rachel's points out, when we think about cases of killing versus letting die, or in particular active versus passive euthanasia, we want to make sure that all things are equal. Okay, so we need to try to hold as much fixed when you compare the cases, because you don't want something like the motive to get in the way, the consequences, how hard it is on the people, or maybe the trauma of a doctor who has to inject someone versus, maybe less trauma for a doctor who simply just removes the ventilator. We want to set those things apart. Imagine that the motives are the same. Imagine that the consequences are the same. Hold as much as you can equal, and then that will tell you. That way, those things don't get in the way when you're comparing the difference between killing and letting die. If you have the same motivations, we want to relieve their suffering, we want to relieve their suffering here, the doctor's going to be affected the same if he does this or that, then we can really see if there's a difference, right? And the difference doesn't come to just the motives or the effects on the doctor. It comes to whether this thing, killing, active euthanasia, is actually different than this other thing, letting die, or passive euthanasia. Okay. Now, the AMA position and the position that Rachel's wants to fight against calls the difference view. The difference view. There is a morally relevant difference between these events, killing and letting die. Thus, it's called the difference view. Now, Rachel's is going to defend the no difference view. And let me say this too, because I just used his last name, Rachel's. Rachel's is a guy. He's a man. His name is James. James Rachel's. I've seen over and over and over again students referring to Rachel's as a woman because his last name is Rachel's, that if you remove the S, looks a lot like a woman's name, at least a common woman's name anyways. And it's a small point, but you just see this over and over and over again. Students saying she says and her view is, and Rachel's is his last name, so just keep that in mind for these little mistakes. Okay. No difference view is the view that all else being equal, right? If the doctors have the same motives, if the patient has the same condition, if the patient's suffering the same in two different cases, if all the consequences are the same. Imagine everything of sort of interest is equal, is the same in both cases, except that one is a killing, active euthanasia, and one is a letting die, passive euthanasia. Then he thinks if you hold these things, if all else is equal, there's no morally relevant difference between killing and letting die. The nature of the act killing is not morally relevant, it's not morally relevantly different than the nature of the action or omission, letting die. Okay, so then active and passive euthanasia cannot be morally different on the grounds that one's a killing and one's a letting die. Okay, so we can't say yes, active euthanasia, that's worse than passive euthanasia because this kills. This is a killing. You're actually actively killing someone, and this you're not killing. You're just letting them die for good reasons. And Rachel's is going to say, well, all else equal, killing and letting die are not morally different. There's no morally relevant difference here. And therefore, there's no morally relevant difference between active and passive euthanasia, at least not on those grounds. At least not on, it can't be justified by killing and letting die being different. Okay, so that's what he's going to do. And it gives three arguments for this view. Okay, the first argument has to do with suffering. So we'll call it the argument from relieving suffering. So the structure here is going to say, well, if the motivation is relieving suffering, then you're going to get no difference. So imagine this case. Imagine somebody's suffering from terminal cancer of the throat. Okay, they have untreatable pain. It just, for whatever reason, maybe scarce resources, maybe the tolerance has gone up on the pain meds and it's just really dangerous to increase their dose anymore. And so you just can't give them the dose that they need to treat the pain. For whatever reason, doesn't matter about the details, just about the principles underlying this, right? So suppose someone with terminal throat cancer is dying and they're suffering incredible but untreatable pain, and we're as certain we can be about anything that they're going to die in a few days. Okay, all the evidence, everything we know about this, past people with this disease and everything, just as certain as we can be that they're going to die in a few days. Okay. Then they ask the physician to die. They want to die. They know all this. They're aware of all this. They've, lived the life that they've wanted to live so far, and they're happy to just die now instead of waiting a few days in misery. Right? And then suppose the family and everyone, the physician, all agrees that it would be better for them to die than to continue living for a few days. That is just the decision to allow euthanasia. Okay, that decision here, they ask the physician to die because of these reasons, and right now we're focusing on suffering because they're just going to suffer unnecessarily for a few days with no treatment, no chance of living. And therefore, when the physician, the patient, and the family all agree that they should die, that's just deciding that their death is a good thing. It's at least the better thing than them living more. Okay, that's just euthanasia, good death. They think, okay, the death in this case is good. Right? Death now, not death in a few days. Okay. So suppose that we've agreed with all that. Now, Rachel says, think about the reason for letting them die. Well, he says, look, it seems like we're letting them die, right? We've decided euthanasia is permissible here, that their death would be good because of humanitarian reasons, because we want to relieve their great suffering. It just seems really unnecessary to let them suffer for 3 days there's no treatment for their suffering, there's no treatment for their disease, and so they're just going to suffer unnecessarily for 3 days. All right? It's like, if we look at that, and we see the reason, the principle that we're using to justify letting them die, which is to relieve their great suffering. But now suppose that we could do a quicker death than just letting them die, right? Maybe they don't die right away, and maybe they end up dying in a few days. right? We stop treating them and we just kind of let their disease take its course. It could still take a few days. And then that would kind of defeat our purpose of this whole justification, right? And so if you could give them a lethal injection, which would relieve their suffering much more quickly and avoid those few days, Rachel says that seems better. This is the really important part. Once we have decided that it's permissible to end their life in order to relieve their suffering, right? Once we've decided that, we've already decided that. He's like, look, imagine we've decided it's permissible to let them die because of their suffering. Well, now if you have the means to end their suffering sooner, it would seem cruel not to do that. Right? We should end it as quickly and painlessly as possible, he says. We've already decided we think it's okay to let them die to relieve their suffering. Why wouldn't we do that sooner? That's his point. It seems like not only is killing worse than letting die, Rachel actually thinks we have a case here where killing seems better than letting them die. Because if we just let them die, that is to say we don't do anything, right? Where did it go? I lost it. Oh, there it is. We withhold life-saving treatment because we think, look, we're just prolonging this person's life. They're suffering unnecessarily. Let's let them die. If we just withhold treatment, let die, they're going to suffer for a few more days. But if we administer life-ending treatment and kill them, again, important, once we have already decided that it's okay to end their life to relieve their suffering, why wouldn't we just do that as quickly and painlessly as possible? Okay, that's Rachel's point. Now he gives another example. Kind of make the same point, just different example. Imagine there's someone who's had a Down syndrome baby, just born with Down syndrome. Okay, he uses this case because this is not so rare, relatively common, that Down syndrome baby is born with an intestinal obstruction. Okay, they have some obstruction in their intestine that they will die unless a risky operation is performed. Okay, so it's a pretty risky operation. If they don't do it, the baby's going to die from this obstruction. Not right away, but they will die from it without the operation. But the operation's really risky. Okay, now suppose that the parents decide that the lower quality of life of having Down syndrome as opposed to not, and the high-risk surgery, suppose the parents decide that that's both of those things together. This surgery is really high risk. The baby has Down syndrome already, so they're already going to have somewhat of a lower quality of life. Let's just let them die because this surgery doesn't have a really high probability anyways, and it may just complicate things. Like, there's a lot of risk here in the consequences of this. It might prolong the suffering, it might increase the suffering, make things worse, right? That's just going to be, and then how the parents would feel having to go through that, right? Brand new baby, so not really any life lived yet, but it will have a lower quality of life. That's at least imagine. And this is not a made-up case, right? This is just taken from decisions that have been made like this, right? Suppose the parents and the physicians decide, okay, that's your decision. You have the right. You're the parents. We let them die. Just suppose that. So suppose the family and the physician agree that it's better, given the low quality of life, given the obstruction, and given the high risk of the surgery that would need to be performed to save them, that it's better just to let the baby die before things get worse. Suppose that we agree on that. Again, same thing. This is just another case in which it seems better to put the baby out of its misery rather than let it die. I think in the paper, I'm not 100% positive about this, but I think in the paper, Rachel's mentions or appeals to and briefly discusses a real case of this, where at least where a real case of it, like what a doctor has to say about a case that he's been through like this. So, I mean, again, this is not made up. This happens So this is just another thing where, look, if we assume we've already decided that it's justified to let the infant die for the reasons above, and if you don't like these reasons, just think of another case where it's more extreme or whatever. The point is not about, Rachel is not saying it's okay to kill Down syndrome babies because they don't have a good quality of life. He is not saying that. Not even 1% is he saying that. He's not saying anything about that. He has no opinion about that in this paper. So if that sounds like that, then there's a misunderstanding going on. He's not saying that it's permissible to let Down syndrome babies die. He's not saying it's permissible to just let people with throat cancer die. That's not what he's saying. He's saying, look, suppose, as has happened before in real life, that a throat cancer patient wants to die because they're only going to live for a few days in misery. Or suppose that parents and a physician decide that it's okay to let a Down syndrome baby die because it has an obstruction that will kill it, and the surgery to save it is really risky, and it may even make things worse. Just suppose that happens. Okay. What Rachel's is saying is, if you think that it's permissible to let a person die in such a case, and the reason is to avoid pain and suffering, unnecessary pain and suffering, it's humanitarian reasons that justify your saying that it's permissible to let the person die. Rachel's claim is, once you assume that, then killing is either equal or even better in some of these cases, because it's going to get you what you wanted, relief of pain and suffering for this individual, much quicker and much easier, right? That's what he's saying. Assuming, this is just, I can't emphasize how important this is. And it's, again, because this mistake gets made when people read Rachel's. Assuming we've already decided it's justified to let the person die for whatever reasons. Here's some example reasons, but use your whatever. If you don't like those reasons, think of other reasons. If you think it's okay to let the individual die for humanitarian reasons, that is, for sort of consequentialist or relief of suffering reasons, then once you've decided that, killing should be no different. That's his claim. Okay. The grounds for justifying letting someone die often give us equal and even more reason to actively kill the person. That's what they're meant to show. The argument from harm, right? Or the argument from relieving suffering. Same idea. Here's the argument. It's sometimes permissible to let a person die in order to relieve their suffering. This is just an assumption for the sake of argument. It's like, let's assume that's true. If you don't think that's true, then there's not really a question about the difference between active and passive euthanasia, because if you already think it's wrong to let someone die, right? So again, he's not trying to say euthanasia is permissible. He's trying to say, what's the difference between active and passive euthanasia once you think euthanasia is permissible? That's what he's trying to say. So assume it's sometimes permissible to let someone die in order to relieve their suffering. Well, sometimes killing the person more effectively relieves their suffering than letting them die. Okay, and that's from the examples that he gave. Well, if those two things are true, if 1 and 2 is true, then it's sometimes permissible and maybe even preferable to kill a person in order to relieve their suffering. Therefore, it's sometimes permissible and even preferable to kill a person in order to relieve their suffering. And what does that tell us? If you assume that it's okay to let someone die to relieve their suffering, then it follows that it's okay, maybe even preferable, to kill that person for the same reason, to relieve their suffering. Okay. And again, this may get annoying how much I emphasize this, but it's really important. James, Rachel's, is just saying that if you think letting die is permissible for the relief of suffering, then you should think killing will be equally, maybe even more, permissible in some cases for the same reasons. Okay, so it's just about the difference between killing and letting die. All right, here's another argument that he gives. This argument is, which is called the argument from Illegitimate Grounds, and the idea here is that if you assume the difference view, the view that he doesn't like, the view that there is a difference between killing and letting die, if you assume that view, then you're going to allow individuals to die for really bad reasons. We'll see. Okay. So consider the Down syndrome case again. Same idea. The Down syndrome baby has this fatal intestinal obstruction, and what he's going to do is argue that, look, if you think that the difference view is right, then life and death decisions are going to be made on illegitimate grounds. Allowing the infant to die is going to be made on illegitimate grounds. And we'll see. Okay, so first of all, an important point here. The surgeries are typically actually not that risky. Okay, the surgeries to remove these intestinal obstructions. Not that they're free of risk. It's just they're not that risky. And, at least not that risky to where it's just like a really easy decision just to let them die. Right? So when parents do let their Down syndrome babies die, which again is a real thing, does happen, that's typically based on the fact that the baby will have to live with Down syndrome and have a lower quality of life. Okay, that's typically the reason, because the surgeries just aren't that difficult. Of course there's risk, but they're not that difficult. And so the fact that the Down syndrome baby will have a low quality of life is doing a decent amount of the work here. Okay. And since the obstruction is fatal, they use that as a reason to let it die, to avoid the lower quality of life. They use the fact that it has a fatal obstruction as the main reason for letting it die. Well, I should say, the intestinal obstruction being fatal is sort of the push that pushes it over the edge. It says, okay, because of the low quality of life, because we want to avoid that, and look, if we just don't do anything, they'll die. Right? It's fatal. The fact that it's fatal is important. They wouldn't just leave it in there if it wasn't fatal and just let it suffer forever and ever, right? And then go on and live an even lower quality of life with this non-fatal intestinal obstruction. It's the fact that the obstruction is fatal. And they use the fact that it's fatal, as a reason to let it die to avoid lower quality of life. Okay. So what ends up happening now, once you get that, is that whether or not you have an intestinal obstruction, and really whether or not you have a fatal one, that ends up deciding whether a Down syndrome baby lives or dies. Okay. Babies' lives, Down syndrome babies' lives, at least in this case, can now depend on whether or not they have an easily fixable but fatal, if not fixed, intestinal obstruction. Okay. That becomes kind of the deciding factor. Because look, if they don't have one, this question doesn't even arise, right? The fact that they have a low quality of life, the parents might still be sad about that. They might still figure out what they need to do. All these things might still come up. But if there's not something external, some independent thing that will kill the baby if they don't do anything, if that isn't there, then it's not like, okay, we're not just going to kill the baby ourselves, right? Obviously, that's crazy. But if it has this fatal condition, then now they get to decide, oh, well, maybe we can just let it die, because it's going to die anyways if we don't do anything, and it's going to have a really low quality of life. And so you see that just whether or not the baby ends up having this obstruction sort of becomes this reason to end or prolong its life. It becomes the sort of decision maker about whether we even talk about whether this baby lives or dies, right? Okay, and again, Rachel's not saying anything about the permissibility of killing Down syndrome children. No matter what you think about how worthy their lives are, what their quality of life is like, he's not saying anything about that. Whatever you think about that, what he's saying is, if you think the difference view is true, then that gives you this room to make this decision. If you think it's okay to let things die, or at least it's much, much more permissible and way less bad than actively killing an individual, well, then that difference view just opens up this door to let infants die whenever they have let Down syndrome infants die as soon as you find out that they have an intestinal obstruction. That's the deciding factor. Just whether they have this, which is illegitimate, but if you didn't have the difference view, you wouldn't have this sort of setup of the problem. Okay, so here's his argument here. If the difference view is true, if killing and letting die are morally different, and in particular, if killing is much worse than letting die, and even more specifically, if letting die ends up being okay sometimes, but killing not, if that's what you think, then this can get you in a situation where morally irrelevant factors can determine life and death. Morally irrelevant factors being whether you randomly had an intestinal obstruction or not. But morally irrelevant factors, like whether you have an intestinal obstruction, should not determine life and death decisions. They don't have the weight, the substance to do that. They are morally irrelevant. The Down syndrome baby that has an intestinal obstruction is not worse in terms of their value than a baby who doesn't, right? But because of this view, where it's okay, it's permissible sometimes to let someone die if they're going to die and all you need to do is not do anything and they'll die. And that's okay as long as you don't kill them. If you have that view, the difference view, then that will get you in these situations, or at least can. It says sometimes morally irrelevant features like whether you have an intestinal obstruction can determine whether a life and death decision occurs. But that's wrong. And the difference view makes that possible. Therefore, the difference view needs to be rejected. That's the second argument. All right. Now, this last argument is about the motivation for holding the difference view. The motivation being, why would you think the difference view is true? And Rachel says, let me see what motivates people to hold this view, and we'll see if the motivation is good. The reasons that people hold this view actually stand up, and he thinks they don't. So argument against the difference view motivation. Maybe it's better this way. Against the motivation for the difference view. Argument against the motivation for the difference view. And if the view isn't motivated sufficiently, then there's no reason to hold it, right? So he's going to attack the reasons for holding it. All right. So, okay. The main motivation, he says, is that killing seems much, much worse than letting die. He thinks that's the main motivation. Killing seems worse. That's why people think passive euthanasia is okay than active, because it just seems worse to kill someone than to step back and let them die if they want to die. Right? You put hands on. That seems worse. Okay. Now, he's going to argue that killing is not worse than letting die, with a different kind of example. Okay. So, he offers two cases. So, two cases that are meant to be looked at side by side. Two different versions of the same case, really. Okay, they're exactly alike, except that one is a killing and one involves letting die. Okay. Then, since everything else of relevance is fixed, the person's motivation for doing the killing or doing the letting die, the consequences of it happening, everything else is held fixed, held the same across the cases. Excuse me, sorry. That means we'll be able to judge whether there is a morally relevant difference just in virtue of one being a killing and one being a letting die. We can isolate those two features, killing and letting die, and see if those make a difference. And so we won't be confused by we think the killing's worse, but maybe it's because the person doing the killing was doing it for bad reasons or whatever, and that's what's making us think it's wrong. We're going to hold all that fixed. Okay. So here's the main structure of the case, and then they split a little bit. So both cases have the following features. It's called bad cousin. So there's two cousins, okay? One cousin stands to gain a really big inheritance if another cousin dies. Okay, there's two cousins. If one of them dies, they're not like sick or anything, but if one of them dies, the other person gets a big inheritance, okay? Now, because of this, the first person, the one who stands to gain the big inheritance, plans to kill the second, their rich cousin. Okay, they plan to kill them in order to gain the inheritance. So it's bad reasons, right? They're kind of being a jerk here, to say the least. And the second person ends up dying because of the thing that the first person does. That's the same. Okay, that's the same in both cases. So in both cases, the inheriting cousin, the cousin who's going to get the inheritance, does the same thing. Or excuse me, they don't do the same thing. They are in the same position, right? They have the same intentions. They're going to inherit the same amount of money. If the person their cousin dies, they're going to get this inheritance. They plan the same way. They have the same intentions, the same reasons. And then in both cases, the rich cousin dies because of what the first person does. The first person does something different. The killing cousin does something different. But in both cases, what they do ends up resulting in the rich cousin's death. Okay. So in one case, the cousin sneaks in to drown the other one in the tub. Okay. The rich cousin's taking a bath. And the first cousin's like, I'm going to kill them because I want this money. And so they go and they sneak in order to drown the person in the tub. And they're successful in doing so. And then he makes sure it looks like an accident. Right. In the second case, the cousin sneaks in order to do the same thing. Sneaks in to drown them. But once he gets in there, he sees, oh my gosh, the cousin's already drowning for whatever reason. And he could easily reach in and save him. But because of his plans, he does nothing. Just stands there and watches him drown. And then he dies. And then, like in the first case, he makes sure it looks like an accident. So what Rachel's wants here is two cases where you have one person going and planning and intending to kill this other person, right? So the motivations are all the same. But in one case, they actively kill them. They drown them, push them down, hold them under and drown them, make it look like an accident. In the other case, that's what their intention was. But then the person's already drowning. So they're like, oh, no need. I'll just stay here and watch. I don't want to get my hands dirty, so to speak, if I don't have to. And then they end up just drowning and dying when they could have easily helped them and pulled them up. And in both cases, they make it look like an accident. So the only difference is that one of them is a killing and one of them is a letting die. That's the idea. All right. So now Rachel's has the judgment that there's no difference morally. We should evaluate these cases the same. The person, the first cousin, the killing and letting die cousin, the one that sneaks in to drown the other one, they're equally blameworthy in both cases. They're equally responsible. Their action is equally wrong. There's not anything morally worse or better in either case. That's James Rachel's judgment. Okay. Now, the upshot here is that euthanasia is not going to be any different. At least morally speaking. Okay, yes, there's some differences between euthanasia, right? The doctor obviously has good motivations for euthanasia. That's part of what euthanasia is you want to allow the person or to actively contribute to the person dying because you think it's good for them and because the patient thinks it's good for them as well, right? So obviously there's different motivations. But the point is, if we hold all of this fixed between two cases of euthanasia, then there shouldn't be any moral difference just because one is active, a killing, and one is passive, a letting die. So administering a life-ending treatment is not morally different than removing or withholding life-saving treatment. Why? Because the main motivation here, where'd it go, is that killing is worse than letting die. And as we could see from the bad cousin case, James Rachel says, there is no difference between killing and letting die. If everything is the same, and then except just one of them the person kills and the other one the person lets them die, but everything else is the same, the setup, the background context, the motivations, the consequences, then the fact that one was active and killed and the one was passive and just stood by and let them die, Rachel says there's no difference there. So why should it matter in euthanasia? And therefore, active versus passive euthanasia, no difference. Okay. And again, once we've said what the right end is, that it's okay for their life to end, the method of getting it shouldn't make a difference. Why do we think it makes a difference? Rachel's wants to give a kind of error theory here. This is why, he says, this is why you might think that killing is worse than letting die. that active euthanasia is worse than passive euthanasia, because you're confused. You're getting confused about these many different examples where killing is really bad and letting people die is really good. There's lots of cases where killing is really bad, and we think of killing as a bad thing, right? And letting someone die is often good. I mean, that's the most of the time, that's what euthanasia looks like, letting die, right? So there's just more examples of killing being bad than there's killing being good, and more examples of letting die being good than letting die being bad, and so we just think killing's worse than letting die. But it's irrelevant. How many cases we can think of these things, it's irrelevant. We're just being confused, because if we isolate them, we can see that they're not different. So here's the argument. Yeah. If the difference view is true, then every case of killing is worse than a case of letting die, holding all else of moral relevance fixed. But some cases of killing are not worse. They're no worse than a case of letting die. Sometimes they're even better. Right? And holding all else fixed. So, therefore, the difference view is false. Because the difference view says, whenever you get a killing and you compare it to a letting die, holding all the morally relevant stuff fixed, killing's going to be worse. And Rachel's like, well, we can see that that's not true. Because I've just given you at least 3 different examples where it's not true that killing is worse than letting die, holding everything fixed. If all we're changing is the method of ending the life, active versus passive, then it's not always worse. In fact, sometimes it's better to kill, so you can relieve suffering quicker, or whatever it may be. Therefore, the difference view is not getting the right results, and it must be false. Okay, so a couple additional worries to address just towards the end here. The cause of death. Okay, so some might try to resist the implications of this argument. They might try to object to Rachel's. They might try to object to Rachel's argument on the grounds that, look, it's worse to cause a death than to let another cause of a death carry on, like a disease. Right? So you might think, well, it's not about acting and omitting. It's about being a cause. Right? It's about being a cause of a death. So you might think, well, it's just worse to cause a death than to let something else, like a disease, carry on and cause the death. And Rachel says, well, look, this is just not a really good view of what it means to do something, to act. The doctor that stands by and lets the patient die, they do something. They decide to stay there. They decide to not intervene. That is a kind of doing in a relevant sense, anyways. What we don't want to do is get mixed up terminologically and just be arguing about words. So it's like, well, you're not really doing anything. You're omitting from doing something. Well, like, okay, but don't worry about what we call it. What is the idea here? You are still engaging in some deliberative process that results in settling mentally, forming an intention, deciding to have some outcome, whether that's stand still and don't give the treatment, or remove the ventilator, or inject the concoction, whatever it is, right? It's really about this mental act of deciding what to do. And of course, when you decide to stand still, okay, you don't move and perform any overt actions, but that's not what's relevant. What's relevant is what your decision leads to, right? The fact that you are doing something by deciding and intending. And that's what's relevant. Okay, so just trying to move to the cause. Well, oh, you're actually a cause of the death. And the other one, that, first of all, it's not clear that that's even true, because let's say removing the ventilator seems like you're a cause of removing the impediment to let the disease carry on. And that removing causes, in an important sense, the disease to carry on, right? And so does standing still when you could resuscitate the person or whatever. Okay. All right. Also, causing death seems bad because death is an evil. That's why we think this. It's like, here's another problem with this objection. Causing death only seems bad because death seems like an evil. But look, we've already decided that death is the right thing in these cases of euthanasia. again, he's not arguing that euthanasia is always permissible. He's not even arguing that it's sometimes permissible. Not in this paper, anyways. What he's arguing is that imagine you thought euthanasia was permissible. Then is it different to let die or kill? He's like, no, if you've already decided that death is the right thing, right? You've already decided we want to relieve their suffering or whatever it is. We want to respect their autonomy, or maybe both of those things, and therefore it's okay to let them die. Well, then death isn't an evil. So you can't say, well, causing death is worse than letting death happen because causing death is like causing an evil. Well, no, not if you think that death is good, in this case anyways, in this circumstance, then this objection doesn't work again. Okay, so now there's some issue that people raise that, well, these aren't practically relevant. The law constrains doctors' actions, first of all. Okay, because you might think like, well, this isn't going to tell us anything about the law. And so, first of all, Rachel says, okay, if you think Rachel's arguments aren't practically relevant because it's not going to like be able to make policy off of this or something like that, or change actual laws in the hospitals, it's like, well, first of all, look, the laws constrain the doctor's actions. Okay, and so it might just be a bad law. So that's a different issue. Second, if they appeal to this like AMA code or like a doctor's code or something, then what we're doing is not about practicality here. We're back in the moral realm about what's right and wrong. If you appeal that it's permissible in the AMA code, right? So then we're just going to go back to the moral arguments that he gives. So the idea here is that, again, just review, that once we decide that euthanasia is permissible, once we assume that, then it shouldn't matter if it's active or passive. Okay, and even less strong than that. This idea that killing or active euthanasia is always worse than passive euthanasia or letting die, that's false. That's what he wants to say. Therefore, if you decide on euthanasia being permissible, then you shouldn't think that automatically this is going to be the more moral way to do it than this. This is always wrong and this is always good, or this is always better than this. He's given 3 arguments to think that that's not true. The argument from suffering, right? If you assume letting die is good for relieving suffering, then oftentimes killing is the best way to do that because you're going to relieve suffering more quickly and with less pain. Argument from illegitimate grounds. Well, if you assume the difference view is true, then this will get you in situations where morally irrelevant features, like having a fatal intestinal obstruction, will be the determining factor of whether you end up dying or not. And that doesn't seem right. And then finally, what's the motivation for accepting the difference view? Well, it's that killing's always worse than letting die. That's what Rachel thinks anyways. Is that good motivation? Well, no, because then every case of killing would have to be worse than letting die. But we could see with the bad cousin case that once we hold everything fixed, it really doesn't make a moral difference whether you kill or let die. At least not always. Okay, the difference view says killing always worse than letting die. And Rachel's has tried to show that that is false. All right, thanks.